6ਵੀਂ ਖਬਰ ਓਟਾਵਾ ਦੇ ਵਿੱਚ ਇੱਕ ਵੈਕਸੀਨ ਕਲੀਨਿਕ ਦੇ ਵਿੱਚ ਨਿਊਜ਼ ਕਾਨਫਰੰਸ ਦੇ ਦੌਰਾਨ ਸਿਹਤ ਮੰਤਰੀ ਨੇ ਕਿਹਾ ਹੈ ਕਿ ਕੈਨੇਡਾ ਦੇ ਇੱਕ ਅਖੌਤੀ ਤੀਹਰੀ ਮਹਾਮਾਰੀ ਦੇ ਘੇਰੇ ਦੇ ਵਿੱਚ ਹੈ, ਜਿਸ ਦੇ ਵਿੱਚ ਕੋਵਿਡ-19 ਫਲੂ ਅਤੇ ਸਾਹ ਲੈਣ ਵਾਲੇ ਵਾਇਰਸ ਸ਼ਾਮਲ ਹਨ। ਡਕਲੋਸ ਨੇ ਕਿਹਾ ਕਿ ਸਾਡੇ ਬੱਚੇ ਹਰ ਤਰ੍ਹਾਂ ਦੇ ਵਾਇਰਸਾਂ ਤੋਂ ਪੀੜਤ ਹਨ। ਸਾਡੇ ਸਿਹਤ ਸੰਭਾਲ ਕਰਮਚਾਰੀ ਬਹੁਤ ਥੱਕ ਗਏ ਹਨ। ਡਕਲੋਸ ਨੇ ਕਿਹਾ ਹੈ ਕਿ ਵੱਧ ਰਹੇ ਹਸਪਤਾਲਾਂ ਦੇ ਵਿੱਚ ਦਾਖਲੇ ਨੂੰ ਰੋਕਣ ਦੇ ਲਈ ਵਧੇਰੇ ਬੱਚਿਆਂ ਨੂੰ ਆਪਣੇ ਕੋਵਿਡ-19 ਅਤੇ ਇਨਫਲੂਐਂਜ਼ਾ ਸ਼ਾਟਸ ਲੈਣ ਦੀ ਜ਼ਰੂਰਤ ਹੈ।
So I'll be very brief because you see all the excitement around and all the great things that are happening in this particular community. It's absolutely essential that people speak about vaccination. Vaccination is something that has made a huge difference in COVID-19, and we know it is particularly valuable right now as our children are suffering from all sorts of respiratory viruses. Our pediatric hospitals are overwhelmed. Our healthcare workers are very tired. Our families are also struggling. So now is the time to get vaccinated and to be protected, individually, but also in a family and in the work environment, especially with the fall. It is going to be increasingly difficult. Christmas is coming too, so we want to be safer in our family environment. And the winter will also be very key. So now is the right time to do that. And for more, I'll turn to Dr. HS. The Prime Minister is leading, and he has already signaled, and he has asked me to say that explicitly, that there will be more funding through an increase in the CHD and through bilateral targeted funding, targeted on the priorities of provinces and territories. So he has said that already. That's at the level of the Prime Minister and the Premiers. My level is with the health ministers. And the good news is that with health ministers we agree on the diagnostics that we are seeing across Canada when it comes to our healthcare system, which is currently in a crisis, and that's because we're having a health workers crisis, but also agree on the solutions to that crisis. So our relationship is very strong and is very positive, and I'm continuing that relationship almost every day. Yesterday I spoke again to a couple of my health minister's colleagues. We have had 11 meetings since last year, plus the one in Vancouver 2 weeks ago. And we're going to have these discussions very regularly because we want to add to the support that the federal government has already provided so that we can give greater access to family health teams. We can reduce the time it takes to have access to a cancer surgery or diagnostic. We can provide more and timely mental health services. And we can make our data system in Canada a modern system, and that means helping share information across pharmacists, across physicians, nurses, lab technicians. We want people to have access to their electronic medical records. Like here, if you look behind me, people are entering the information on vaccination status so that information is shared with, say, physicians and hospital workers. That's not, unfortunately, a very common thing that we see in Canada nowadays. Data saves lives, so we also want to support colleagues across Canada in making our system more modern.